Before COVID-19, our teenage pregnancy rate was quite high. For instance, 1 in every 4 girls was either pregnant or had already given birth. But now, after 2 lockdowns, we can no longer afford to sweep teenage pregnancy under the carpet. Data from World Vision Uganda shows that between January and December 2020, 298,127 teenagers aged between 13 and 19 years visited public health facilities for their first antenatal care. The statistics represent data collected from 48 districts. The months of May, June, and July, 2 months into the COVID-19 lockdown, had the highest number of pregnant teens visiting health centers. The most affected districts were Wakiso, with 8,528 teens, Kampala, with 7,359 teens, and Tororo, with 5,491 pregnant teenagers visiting health centers throughout the year.
The schools are the first safety net for children from all kind of vagaries, violence against them, marriage, and harmful cultural practice, and even for nutrition purposes. So when schools are closed, then that safety net for children is taken away.
Research done by Girls Not Brides Uganda, a local NGO, shows that in terms of future earnings and antenatal care, the country loses between $18 to $30 million annually.
Of social capital one, in terms of the human capital development, because the higher the child goes, the more chances that they could get a formal job, a better paying job, that they could be able to get their families out of poverty.
Although the effects of teen pregnancy, like childbirth complications and unsafe abortions, are considered a leading cause of death among teenage mothers, traditions have created stigma around sexual activity in adolescents, and stakeholders believe health education will go a long way in preventing teenage pregnancy. Unfortunately, Uganda does not have a regulatory policy to govern sexuality education.
Almost 22% of all teenagers in Uganda will report that they are having some form of sexual activity. But as Ugandans, we have refused to acknowledge that people below 18 can have sex, and that they are having not just forced or violent sex, but consensual sex. It has led to us refusing to program things like sexuality education into our policies.
The numbers pointing to a looming baby boom among teenagers show that sexually active teens are at a risk. Could giving them free contraceptives be a solution?
There is a policy that was passed where they do not allow teenagers below the age of 18 to access contraceptives in healthcare facilities. If we provide information which is evidence-based, which is usable and acceptable to our young people, and at the same time make sure that services are available for them to use.
High teenage pregnancy rates mean a rise in abortion, and statistics from the Gatmacher Institute show that unsafe abortions cost Uganda $14 million every year. With an estimated 800 abortions being done every day, this money is lost in post-abortion care in public health facilities. With this rise in what is essentially illegal abortion, is it time to advocate for safe abortion policies?
Abortion is one of the safest procedures and one of the cheapest procedures, which can even be done using oral medication, which on the global market costs about $5. So abortion itself can be a way, worldwide, globally, it is a way of managing a pregnancy, but within the confines of the laws of Uganda.
However, Prosper Mubangizi from World Vision believes the way forward is to tackle poverty and encourage families and communities to play their roles in the upbringing of teenagers.
And also this notion that schools are the safest areas for children means that we have forgotten what a family should be doing. Ideally, the family and the community should be the first net.
Keeping girls in school was the first safety net against many vices, including teenage pregnancy. But with schools closed indefinitely, it's time for policymakers to rise to the occasion and tackle the elephant in the room. Gillian Nantume, NTV Tonight.